Incidental COVID cases in Erie County hospitals are on the rise. These are COVID patients who are in the hospital for a reason other than their coronavirus infection. News 4's Chris Hurwitz looked into why this matters from the medical campus.
Earlier this month, Governor Kathy Hochul said this was something she really wanted to study. And at that time, a very strong majority of COVID patients in an Erie County hospital were there because of their COVID symptoms. But county data shows those trends are now shifting.
One of the main goals of vaccination is to minimize severe disease that results in hospitalizations and bad outcomes. And we'd like to accurately measure that.
Infectious disease experts believe they can help measure that by examining incidental COVID cases. That's the term used to describe asymptomatic patients admitted to hospitals for another reason, but end up being positive when tested for COVID. Earlier this month, Erie County Executive Mark Poloncarz gave us a breakdown.
It's approximately 90 to 92% of all COVID-19 patients actually are in a hospital for COVID-19. There is a small portion of it, less than 10%, who may be going for a procedure or were in a car accident, had a broken leg, they test them, they find out they're COVID positive.
But new data released by Erie County on Thursday shows those trends are shifting. Of the 580 hospitalized COVID patients in the county on Tuesday, about 60% of them were in the hospital because of COVID versus 40% who were admitted for another reason. I asked Dr. Thomas Russo what this means in the big picture.
It does demonstrate that Omicron is able to still cause these either asymptomatic or mild infections, even in vaccinated individuals. But at the end of the day, that's good news. I'd rather have these incidental cases than all of those end up being cases in hospital due to COVID.
But they can still be problematic, Russo says. He notes asymptomatic COVID patients in the hospital still need to be put in different rooms and have other special measures taken for them.
So at the end of the day, we'd like to see all of these cases decline.
Russo says those admitted to the hospital for COVID are still primarily unvaccinated and that Omicron is still to be taken seriously, particularly if you are unvaccinated or have an underlying medical condition and are not boosted. Reporting in the medical campus, Chris Hurwitz, News 4.